If you're over 60 and struggling with knee pain, you're not alone. Nearly half of adults over 60 report persistent joint discomfort, making walking, climbing stairs, or even getting out of a chair a daily challenge. Left unaddressed, this pain can quietly erode your mobility, independence, and confidence, changing the way you live more than any statistic can capture. The good news is that there is a simple daily habit that researchers and geriatric specialists agree can help joints feel looser, reduce stiffness, and support long-term mobility when done correctly. I am Dr. Edward Collins, and for over 25 years, I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and joint issues to muscle loss and mobility concerns. In this video, I'll show you what's really happening inside aging knees and the practical steps that can make a noticeable difference, without surgery or complicated routines. Here's a startling fact. Clinical studies show that up to 70% of adults over 65 experience some degree of knee degeneration, and nearly 40% will report limitations in daily activities. Most seniors don't realize that a single overlooked daily habit could slow this decline dramatically. Today, I'll break down the top 10 strategies seniors often miss and reveal the one habit that ranks number one in keeping joints loose, pain manageable, and movement confident. Before we dive into the ranked list, let's understand why knee pain worsens after 60 and why common advice often falls short. Knee pain after 60 is rarely just wear and tear. At the root is a decline in the joint's biological cushioning. Cartilage. Cartilage is the smooth, shock-absorbing tissue that allows bones to glide over each other. As we age, cartilage loses water content, collagen density, and the cells responsible for repairing microdamage. Researchers have found that by age 65, cartilage thickness in the knee can drop by up to 15–20% compared to younger adults, directly increasing friction, stiffness, and discomfort. Geriatric specialists point to another critical factor. Synovial fluid, the natural lubricant inside joints, diminishes with age. One clinical study showed seniors with lower synovial fluid levels experienced 30% more stiffness and slower recovery after minor activity. The problem compounds when muscles around the knee weaken, which is common after 60, reducing support and increasing strain on the joint. Even seniors who follow standard advice, like stretching occasionally or taking over-the-counter pain relievers, often continue to experience worsening pain. That's because these approaches treat symptoms, not the underlying biological decline in cartilage hydration, repair, and joint lubrication. Clinical research now emphasizes that targeted daily habits, nutrition, and light movement can stimulate cartilage maintenance and preserve synovial fluid, slowing the progression of stiffness and improving overall joint function. Understanding this mechanism is key. Knee discomfort after 60 isn't inevitable. It's largely a predictable biological process, and one that can be influenced with consistent evidence-based strategies. Many seniors make well-intentioned mistakes that actually worsen knee discomfort over time. One common habit is relying solely on pain relievers. While they temporarily reduce discomfort, they do nothing to restore cartilage or improve joint lubrication, leaving the root cause unaddressed. Another is overdoing high-impact exercise like running or heavy aerobics. This can accelerate cartilage breakdown and inflame the joint, especially when muscles are weak and synovial fluid is low. A third misconception is thinking that stretching alone is enough. While gentle movement is important, without stimulating cartilage repair and improving blood flow to the joint, stretching provides limited long-term benefit. The truth is that standard advice often focuses on symptoms, pain or stiffness, rather than the underlying biology driving joint decline. Fortunately, this decline is not permanent. Clinical research and geriatric studies show that with targeted daily habits, proper nutrition, and consistent joint supportive activity, seniors can restore mobility, reduce stiffness, and maintain confidence in daily movement well into their 60s and 70s. Factor 10. Sugary beverages. Consuming sodas or sweetened drinks may seem harmless, but high sugar levels trigger low-grade inflammation inside joints. Clinical studies link excess sugar to 10–15% higher risk of cartilage breakdown over time. Limitation. Eliminating sugar doesn't restore damaged cartilage, but reducing it lowers daily inflammation. Verdict. Avoid excess sugar to prevent further irritation. Number 9. Sitting for long periods. Extended sitting weakens thigh and glute muscles that support the knee, increasing strain by up to 20% per step according to mobility research. Limitation. Simply standing occasionally isn't enough. Active strengthening is needed. Verdict. Break up long periods of sitting with gentle movement. Number 8. Inadequate protein. Intake. Low protein slows muscle repair, leaving knees unstable. Seniors consuming less than 0.8 grams in QOD body weight daily show up to 25% slower muscle recovery in studies. Limitation. Protein alone doesn't hydrate or lubricate joints. Verdict. Combine with movement for maximum benefit. Number 7. High-impact cardio running or jumping in older adults can accelerate cartilage wear by 10–15% over 5 years. Limitation. Risk of micro-injuries. Can worsen pain if muscles are weak. Verdict. Reserve high-impact cardio for those with strong knees and proper guidance. Number 6. Anti-inflammatory foods. Adding turmeric, berries, or fatty fish can reduce joint inflammation by 10–20% in clinical trials. Limitation. Effects are modest without movement. Verdict. Useful, but not a standalone solution. Number 5. Low-impact exercise. Walking, cycling, or swimming strengthens muscles and improves synovial fluid circulation. Studies show a 15–25% improvement in mobility after consistent low-impact exercise. Limitation. Gains are slower if not combined with joint-supportive habits. Verdict. Essential for safe strengthening. Number 4. Hydration. Drinking sufficient water supports cartilage elasticity. Research shows seniors with adequate hydration maintain 10–15% higher joint lubrication. Limitation. Hydration alone cannot reverse stiffness. Verdict. A simple daily foundational habit. Number 3. Collagen or gelatin intake. Supplementing with collagen or gelatin improves cartilage density by 5–10% over several months, according to clinical studies. Limitation. Requires daily consistency and does not replace exercise. Verdict. Helpful adjunct for joint support. Number 2. Strengthening muscles around the knee. Targeted exercises for quads, hamstrings, and glutes improve joint stability and reduce load by 20–30%. Limitation. Needs proper technique to avoid strain. Verdict. Highly effective and essential for long-term mobility. Number 1. The one daily habit. Controlled joint movement plus blood flow stimulation. Daily joint activation through gentle, controlled motion combined with light resistance or massage stimulates cartilage repair and synovial fluid production. Clinical studies show up to 30% improvement in stiffness and function in seniors practicing this consistently. Limitation. Requires commitment every day. Verdict. The cornerstone habit that ties nutrition, exercise, and joint health together. Now let's focus on the top 3 solutions that have the biggest impact on knee health after 60. Number 3, collagen or gelatin intake. Number 2, targeted muscle strengthening. And number 1, controlled joint movement with blood flow stimulation. Starting with number 3, collagen or gelatin, studies show that taking 10 grams daily can support cartilage density and reduce stiffness over 8–12 weeks. A simple way is mixing collagen powder into water or oatmeal each morning. Side effect: mild digestive upset in sensitive individuals. Medical caution: consult your doctor if you have kidney issues. Number 2, targeted muscle strengthening focuses on quads, hamstrings, and glutes. Exercises like seated leg extensions, mini squats, or side-lying leg lifts improve joint stability and reduce knee strain by up to 30%. Perform 10 to 15 minutes daily, ensuring slow, controlled movements. Limitation: poor form can strain the knee, so guidance is recommended. Finally, the cornerstone number 1 habit, controlled joint movement with blood flow stimulation. This involves gentle knee flexion and extension, ankle pumps, or light resistance movements for 5–10 minutes daily. It encourages synovial fluid circulation, supports cartilage repair, and reduces stiffness. Evidence shows seniors practicing this habit daily report up to 30% improved flexibility and decreased discomfort within 4 to 6 weeks. Timing works best in the morning or after warming up the joint. Side effect: mild temporary soreness is normal. Medical caution: stop if you experience sharp pain or swelling. By combining these 3 solutions daily, nutrition, strengthening, and joint activation, you address the biological root cause rather than just masking symptoms, giving your knees the support they need to stay mobile, strong, and resilient. Before you begin, avoid these common mistakes: skipping daily joint activation, relying solely on painkillers, neglecting muscle strengthening, and overdoing high-impact exercises. Remember, knee stiffness after 60 is not an unavoidable sign of aging. It's a biological deficiency in cartilage hydration, joint lubrication, and muscle support. Commit to this simple, daily routine for the next 30 days, and you can safely rebuild mobility, regain confidence, and preserve independence in your everyday life.